What is up, Facebook? It is Breast Cancer Awareness Month, and I have my special guest here with me today, Galen. Galen, how are you doing?
I'm great, Reagan. Thank you so much for having me on.
Hey, I'm so glad you could come back with us this month and join us for breast cancer awareness. I don't know anybody more qualified or experienced than you. Why don't you tell all of our guests what you do, how long you've been doing it, and just a little more information?
Sure. So I'm Galen Jones. I'm a registered nurse. My job is I'm the director of the Baptist Regional Cancer Network. And I have been doing cancer care since about 1983. So I have a lot of experience with it. But I've actually been a nurse for over 40 years. So don't age me too much. And truly, oncology and cancer care is really my passion and has been one of the most rewarding jobs that I could ever have had.
So, what made you pick this path? What led you down this? What made you get a passion for it?
I think that early on in my career, I met a medical oncologist, and I worked on an inpatient unit that provided cancer care, and that is really where I developed the passion for it. It has such a great opportunity for you to be able to care for not only the patient but for their family members as well. It is one of those things that encompasses everybody, and it is one of those things that there's great reward by being able to help patients go through their cancer journey.
Awesome. So, why is breast cancer awareness so important? Why do people need to be more proactive? What's so important about this?
Well, with breast cancer is one of those things that when detected early, it is highly curable. And the screening techniques and measurements and the things that we have out there for technology nowadays are so advanced that women really truly no longer have to die from cancer if they're taking and getting screened as recommended.
Awesome, awesome. So, how do people know if they are at risk for breast cancer? Is there any things they should look for?
So, anybody that is a woman that is obviously at risk because we have breasts. So, that's going to put you at your number one risk. It's just the fact that you're a woman. Although men can develop breast cancer as well, the risk is just not as great. For men, the risk is only 1 in every 100, where with women, it's 1 in every 8. So, that's a pretty significant statistically when you look at that. If you're sitting in a room with 20 people within your lifetime, 2 people out of that room are going to develop breast cancer. And when you're looking at risks, there are some family history things like breast cancer can be hereditary. So we do know that there's genetic testing that's available that can help identify if a woman is going to carry the gene for breast cancer. So having like a first degree relative, like a mother, a sister, they've now find like if father has prostate cancer, it can increase your risk. If you have a family member that has had ovarian cancer, it automatically increases your risk as well. So those are just some things that inherently put you at risk. But then there are other things that women can do to help to take and reduce those risks as well.
All right. So, how often should women or men check for breast cancer? How often should this happen?
So with women, really, it is usually taking and having a screening mammogram done, and we recommend that they have them done starting anywhere between age 40 to like 44. Talking with their primary care physician or their provider and seeing whether or not they think that they should start screening at that age. At age 45, everybody should take and have a screening mammogram done annually. So it is one of those things that should be done every year. Lots of times it's a good way to remember it is by having your birthday, doing a little birthday celebration and getting your screening done at the same time. Because mammograms can really detect breast cancer much earlier than what a woman would ever be able to feel a cancer or a lump in her breast. We do recommend that women be familiar with their breast as well. So breast self exams don't always yield being a good indicator of breast cancer, but knowing what is normal for you is really important. So if you're having a shower or you happen to be lying down in your bed and you feel something abnormal, you should know whether that's abnormal for you or whether that's as is normal. So we do recommend that people really do know what their own bodies are like.
Right, for sure, for sure. So just curious, is mammograms the only way to test for breast cancer? Because I know a lot of people do not like mammograms or they have this bad idea of
Yeah.
mammograms.
No, so really, mammograms for women are the only way that you can actually detect if there's breast cancer. There's not like any known blood test or anything like that that can automatically be done. Mammograms are done in women starting over age 40 due to breast density. So if you're under age 40, then they're not going to recommend that you have a mammogram done. But you have to remember that when you do the mammogram, it may be a little bit unpleasant, but it could ultimately save your life. And it's not like they put you in a vice and leave you there and say, hey, I'm going to lunch, I'll be back in 30 minutes. Really, truly, it's pretty quick. And what it can detect is really very amazing. A breast cancer can be detected up to 2 years earlier by having a mammogram done than what you would ever be able to feel the lump in your breast.
So, Galen, I just had somebody ask, does breast cancer increase with age? Does age play a role in this?
Yes, so age definitely plays a role in it. The older you get, the more you're at risk of having abnormal cell development and abnormal cells created. So it's really for any type of cancer, age definitely plays a role in it. However, I will tell you that we are seeing younger women being diagnosed with breast cancer more frequently now than what we ever have in the past. I think the other thing is that COVID really put people off of their schedule, and people had more important things to worry about, and people weren't leaving their homes, you weren't wanting to go seek medical care. So one of the things that we're really seeing is that now, if we're getting breast cancers and we're getting any other type of cancers, we're finding that they're at a much later stage. So it's really important that women go back to taking and having those regular mammograms done, because they truly can save your life. And like I said earlier, breast cancer truly is curable when it's detected early. So the later your stage and the later it gets diagnosed, and the more difficult it is for us to cure.
Awesome. And just curious, do genetics play a role in this? Like if somebody's mother has it, are they more the daughter or the more
Yeah.
likely to get it?
So genetics can, but the caution with genetics is only about under 10% of breast cancers that are diagnosed are actually related to genetics and related to the hereditary gene, which we do that is the BRCA1 and BRCA2. So you can't just rely on the fact that there's no family history of breast cancer, because other things can influence that as well.
This is probably not very common, but I see some people asking if they get, radiation therapy before they're age 30, does this increase their risk to get cancer or breast cancer later in life?
Yes, so having radiation or being exposed to radiation can definitely increase your risk of developing breast cancer. One of the other biggest risks of breast cancer is already having been diagnosed with breast cancer. So if you had an initial diagnosis of breast cancer, then it's not uncommon for it to reoccur either in the same breast or for it to reoccur in the other breast as well.
Wow. So even if you use radiation and it goes away, you said there's a bigger chance that it can still come back
Yes,
again?
yes, that is
Wow.
correct.
What was that percent you said that it usually can come back percent wise?
I don't really have a percentage on that. It was the hereditary
I
cancer that
got you.
the
So
percentage, but it does put you at a greater risk. So women just need to be more diligent and make sure that they're doing their screenings and following up with their providers.
wow. Yeah. I think when it's gone, it's gone, but it's crazy to think that it
Yeah.
comes back a lot. Wow.
Unfortunately, we do see that quite a bit, that you do see people that have reoccurrences with it.
And just curious, does physical activity play a role in this? If you're more
Yes.
physically active?
So there are things that can definitely help reduce your risk of developing breast cancer, and physical activity is one of those things. Just research has shown just exercising for 30 minutes a day will take and reduce your risk of developing breast cancer. And now they're finding, I think, some other types of cancers as well. And the good thing about the exercise is that it really doesn't have to even be all done in one chunk of 30 minutes. You can actually break it up to like 10-minute intervals. We know women inherently are really busy. They're looking after a lot of things, usually juggling a family, a job, and multiple other things at the same time. So just taking those 10-minute increments and adding it up to 30 minutes throughout the day can help reduce your risk of developing breast cancer. Research has shown that even in women that were diagnosed and have a diagnosis of breast cancer, if they exercise, it will reduce their risk of having reoccurrence.
So when I get home today and tell my wife to get off the couch, I'm trying to save her life. Maybe she won't.
Now you might have to take and reference why you're telling her to get up.
I know, right? So I also have read that, drinking alcohol can increase your risk. People probably are not going to like that because, I mean, some people like to have a drink every now and then, right?
You're right. They do, but it definitely can increase your risk. Alcohol plays a role in a lot of different types of cancer, but breast cancer is one of the ones that we have found that is affected by alcohol. So we caution people to, if they're going to drink in moderation. I think the moderation might surprise people because moderation is actually considered to be, for women, 1 ounce of alcohol per day, or 4 ounces of wine. For men, they get moderation is 2 ounces per day, or like an 8 ounce glass of wine or beer or something like that. So I think that people are probably pretty amazed because most people think I can have a glass or two of wine or have a couple of drinks and it won't affect anything. But ultimately, it does play a role and impact your health. Lots of times we hear things about red wine because red wine, it has been proven to be beneficial as a heart protectant. And so we do tell women that that is true. It does. But the same ingredient that is found in red wine is also found in like your Concord grape juice. So you can substitute the wine for grape juice. Might not be quite as fun, but you can pour it in a wine glass and pretend it's wine.
Yeah, I don't think a lot of people are going to like that. So many different factors that contribute to this
Yes,
that you got to look out for.
it is. Tobacco is one of the other major risk factors that you have. So anybody that is smoking, and even with breast cancer, exposure to secondhand smoke has really shown to increase the risk of developing breast cancer as well. So we always really urge people to quit smoking. It doesn't really matter your age or how long you've been a smoker for. It is always beneficial to quit.
So many different factors there. But I also read that having children after the age of 30, and if they don't breastfeed, that can also increase the risk. Is that true?
That is true as well. So we encourage people to do family planning, not to take and have them too young, but it does, for some reason, does decrease your risk of developing breast cancer. It all has to do with your hormones. So that is helpful. Breastfeeding also helps to take and reduce your risk. And so we do encourage women to breastfeed as well if they can. And breastfeeding, they really, to get the maximum amount of benefit from it, research actually shows they should breastfeed up to 1 year. So I know that sounds like an extremely long time, but that is what research has shown with that. And we do know, like, for as far as like not even having any children puts you at increased risk too. So not only having children early, but never having children at all also puts a woman at an increased risk. If there's a high population of, like if you look at nuns, they have an increased incidence of breast cancer, and they feel like was based on the fact that they never had children.
Wow, never knew that. Learning new stuff today. So tell me about your new program, Galen.
Yes, so part of the Baptist Cancer Network, and we also have the Dauphin Women's Center, where we do all sorts of screening mammograms, diagnostic mammograms. You're able to have ultrasounds. They actually do biopsies to help determine if a woman has cancer, because that is the only way that if you truly have cancer, is that you have to have a biopsy done for us to be able to ensure that you really do have a cancer. So that's the only way that you can tell, is by having a positive pathology to do that. So one of the things that we've worked on is that we realize that anytime you go through or diagnosed with cancer, that it is really a difficult journey and that people need additional support. So we have developed what we're calling the Breast Concierge Program, and women that are now diagnosed with breast cancer are paired with a personal breast navigator. And that navigator helps guide the woman through her cancer journey. So she's the one that reaches out to her. She makes sure that she gets to the appointments that has scheduled. If there's any extra imaging or anything needs to be done, make sure she sees the surgeon, is able to answer any questions, make sure that they understand what their treatment plan is, and just really keeps them on track and really gives them that personalized care. We also have some little gifts that we give them along the way, because having cancer is really one of those life-changing diseases. And so we want to make that journey for people as pleasant as we can during that difficult time that they're going through. We want them to have as positive experience.
That's an awesome program. I'm so glad you shared that with us. And for those just joining, can you tell everybody where you work? Because I see a few new people have joined. And tell us a little bit about your one more time
Yes.
to kick it off.
So I'm the regional director for the Baptist Cancer Network, which is a department of the Baptist Hospitals of Southeast Texas.
Awesome. And Chris just said, hey, Galen. So miss seeing you. Hey, Chris, thanks for joining.
Yeah. Hi, Chris. Miss you as well.
So, Galen, thank you so much for joining us today. Is there any last words of encouragement you want to give to everybody watching about how important it is to get tested?
Yes. So October is Breast Cancer Awareness Month, and it is the opportunity for us to raise awareness. So I would just urge each of you to go out and share this message and to look after your health. Your health is really one of the most important things that you have. And breast cancer, when detected early, is highly curable. So schedule your mammogram today.
Galen, thank you so much, and good luck to you. And I hope you have a great rest of October for Breast Cancer Awareness.
Great. Thank you.
Thank you so much.
Thank you.
Hey, we'll see you around. Be careful. Guys, thank you for tuning in, and I hope you realize how important it is to get tested and be proactive. It's Breast Cancer Awareness Month, and Galen has so much great information for you with the Cancer Network here and our new program. But guys, we're here for you 24/7 at Altus for all emergencies, all situations. Guys, be aware, be proactive, get out there, get tested. And thank you so much for tuning in today. We'll see you next time live with Reagan. We appreciate you guys. Stay safe.